All right, welcome back to Live at 9. It's Wellness Wednesday, and today we're going to talk about something that many people are wondering. Of course, why they have to make an appointment just to get a refill on their medication. Today we have Dr. Quinn with us to explain the why. Good morning, Dr. Quinn.
Good morning.
So how do follow-up doctor's visits keep patients safe in regards to their maintenance medication?
Right. So I have like a couple of black eyes from getting beat up by patients over the last 23 years. They'll call and say, I want to refill on my blood pressure or diabetes or cholesterol medicines. And we'll tell them they haven't been here in over 6 months. And we'll say, we need you to come in so we can do some testing. And then they'll say, put Dr. Quinn on the phone. So I'll get on the phone and I'll say, I'm so sorry, but we have to make sure the medicine is safe. And that's what we're going to talk about today, how when they come in, we check their labs, we check their vitals, we check for things that could go wrong over the time. And if we continue the medicine, it can continue to get worse. And I explained to them that it's for their safety. It's just to make them so that they can be healthier. And that's our number one objective, is to increase health and just practice safety at all times.
Absolutely, Dr. Quinn. And can these visits, by any chance, help catch other problems early?
Most definitely. I mean, that's a great point. Most insurance companies, they really want us to do a wellness every year. And then a lot of patients come in for these visits, and we'll do the wellness, which includes for men checking their prostate level, for women maybe getting a mammogram or a pap smear. And also, we send them, if it's time, for a colorectal exam to determine if they have colon cancer. And the best thing about it is all of these problems, if they're caught early, it's a whole different scenario. Like me, I had a brain tumor, and it was caught early, and it was diagnosed as cancer. And all my patients are saying, man, your hair is growing back. And I'm like, I'm on the chemotherapy because my doctor sent me early and got it diagnosed and treated, and that way I didn't have to suffer like a lot of people that go through what I went through, where you're paralyzed on one side and you can't dance. Like I can still dance and everything. But the bottom line is, coming in is not to punish the patient, it's to give them the best possible scenario for the best outcome.
Absolutely, Dr. Quinn. That's so important, right? You're not trying to inconvenience patients. You're trying to put their wellness and their health first and make it a priority. So why is it important for doctors to follow this protocol?
Well, like I said, some of the medications, if you've been taking them for a year, like say for instance, amlodipine. Some people can develop swelling, and some of these medicines can start causing problems with your enzymes, such as your kidney. And if it's diagnosed, we can change it to a different medicine that a lot of weight, and they get to a better state of health. Maybe we lower the blood pressure medicine because it might be too strong, or maybe not strong enough, but there are changes that have to be made, and this gives us the opportunity to make the most educated decision as far as their medication regimen.
That is so important, Dr. Quinn, that some changes could be necessary. Now, real quick, before we run out of time, what should patients expect during this follow-up visit?
Well, basically, as I said, vital signs, we check the blood pressure, the height, weight, heart rate, the temperature, and then if it's time, then we'll do the wellness, and we'll do the necessary screening precautions for different types of cancer, and just make sure the medicine is safe so that that patient has the best chance of the highest level of health as they deserve.